Hello, everyone. This is your infant nutrition class, and really, there's not a whole lot different in this than what you got during orientation. If you know, basically, if you know your teaching notes and remember the class that Alyssa gave you during orientation, you will do just fine. Okay, so here are our objectives, and I am just going to very quickly go through these slides for you. All right, so recommended infant nutrition, breast is best. The American Association of Pediatrics wants babies to have exclusive breastfeeding for the first 6 months and continued breastfeeding for at least 12 months. And then at 6 months of age and on, we start adding other foods to the diet. Okay. The World Health Organization actually wants exclusive breastfeeding for 6 months and then continued breastfeeding for 2 years. And we definitely in this country, I think, have some biases about people who are nursing toddlers. But it really is, again, the gold standard for human nutrition. And babies like it too. Okay. So breastfeeding. It's unique to mammals. It's there to give specific needs. And I did just talk about in newborn adaptation. I mentioned again and again the good things that breast milk does to babies that are transitioning into extrafetal life. So lots of physical advantages, nurturing. Some mothers cannot breastfeed because maybe they had breast surgeries, illness, they might be victims of abuse. And so it's very important. And I'm really big on this because I know we're so big on breastfeeding. But if somebody isn't comfortable with it, it's not going to be a good experience for anyone. And there are some mothers who will pump their breast milk. When you pump, it's not the same kind of action, and so you will lose your milk supply more quickly if you pump exclusively. And they will want to pump and bottle feed, and that's okay. That's what they need to do. If a mother cannot make the milk, we need to be sure to let them know that formula is okay. Many babies, many adults my age, most adults my age were given formula and they survived and they did just fine. So we have to be non-judgmental so that we don't lay a guilt trip on moms if they physically can't or emotionally cannot do that. Okay. So we get immunologic protection. We already talked about that. You can see some of the non-allergic things that happen. Antibodies, especially the IgA, helps with several things. Some of the nutritional benefits are it's easily digested. It's just the perfect concentration of protein, fat, and carbohydrates. The fat content and the iron content are both influenced by the nutritional status of the new mother. So that is nutritional status. And when do we add supplements? You guys should know this. After birth, when do we add iron supplements? That would be around 5 months of age. Okay. Mom stores are used up at about 5 months. So if we start at 4 months, we know we're in good shape. Okay, so physical advantages of breastfeeding, psychosocial, there's increased attachment and a sense of maternal role. You're basically very plugged in to your baby. I I did not want to do that. There. Babies crave tactile stimulation. There's that sense of smell and touch are very well developed in babies, and so this is really good. We think it helps with cognitive abilities, more rapid CNS, and increased pattern of growth and weight. So babies tend to gain about a half ounce in their first few months. So they regain their birth weight in 10 to 14 days after birth. And they don't gain as rapidly as do formula-fed babies, but they do tend to double their birth weight by 5 months. So that's exactly fine. No problem with that. Barriers to breastfeeding are many. We're trying to really encourage more broad social support for breastfeeding. And now you will see, like, I know at the Viking Stadium, they have little alcoves, little breastfeeding nooks that they go into this little, I don't know, it looks like a little trailer, a mini trailer. They go in there and they can breastfeed or pump. They even have one now at the it's kind of like a little pod at the Bismarck Airport I saw the other day. So, but, nobody wants to see mom's breasts in public, even if they're being used to feed her baby, which is what they were made for. And so there is a lot of bias against breastfeeding. There's a sexualization of breastfeeding, which is not cool. And then there's lots of marketing. Infant formula companies want to give moms gifts and give them coupons and all of this. And really exclusive breastfeeding is very, very important at first. If you start supplementing with formula, mom's breast milk supply will go down. So we know that is true. We know that in the beginning, it requires tons and tons of support. It's a learned thing for both mom and for baby. Usually with the second baby, things go a little bit better because mom is comfortable, but there's still a learning curve for baby. It can hurt. A lot of moms have to go back to work very quickly, and it's difficult. It really, really takes a ton of commitment, and so not everybody has this kind of support that they need. So contraindications, there are few. Maternal diseases like HIV, AIDS, TB, active herpes lesions on the breast. Obviously, those are things that we would say no breastfeeding. Maternal medications like lithium or digoxin or chemo definitely is a no-no. A disadvantage is that it excludes the father, but there are ways, especially after the first 2 weeks to a month, that fathers can start adding a bottle in here and there. They can get up and bring the baby, change diapers, bring the baby to mama. They can also do skin to skin too. It requires a lot of commitment and time from mom and also from the rest of the family. But mom particularly is kind of just that baby is attached to your breast. It really seems like for the first few months for sure. Okay, so how does breastfeeding work? This is the kind of the pathophys or the pathology or physiology, I guess, for breastfeeding. Lactation, prolactin is something that comes from the anterior pituitary gland. It's a hormone. Prolactin helps prepare the breast and the ducts, etc., to secrete milk, and it starts during the pregnancy, okay? And it synthesizes, helps make the milk and secrete the milk during lactation. So you need to know that. And then oxytocin comes from the posterior pituitary gland. And what does oxytocin do? We know it stimulates contractions. Oxytocin is also known as the love hormone. It helps. It's one of the hormones that's secreted for orgasm. And it is also the same hormone that stimulates the milk ejection, or it's called, the milk ejection reflex or the letdown reflex. And I'm sure you guys are more familiar with that. So letdown reflex can be initiated by hearing a baby cry. It doesn't even have to be your baby, but any baby, or seeing or thinking about the baby. I had a friend who was nursing, and she would walk by the nursery and she'd have a letdown reflex. And so it can be kind of messy if your milk is letting down and you're walking around. All of a sudden you look down and you have wet spots running down your shirt from your breast. So moms have to put nursing pads in that will soak that extra breast milk up to decrease embarrassment. But you can see the physiology here and the anatomy. Anterior pituitary, posterior pituitary. So this is a really good slide to study. Remember what each hormone does, prolactin and oxytocin. You need to know those two things for sure. Okay. What do you need to have enough? We know that this whole process is supply and demand. The sucking stimulates the production of prolactin and oxytocin. Okay, so the more you nurse, if you want more milk, you need to nurse more. Okay, you also have to be sure that you're drinking enough fluids. All right. How do we know? One of the biggest questions that we have is for moms, how do we know that the baby's getting enough? If the baby, and you guys should write these down, these are important. If the baby is sleepy, relaxed, sated after feeding, and is resting in between feedings, if during the feeding you hear audible swallowing, and if we have, after the first couple weeks or after the first 6 days, you have 6 to 8 wet diapers during a day, that tells you that the baby's getting enough. Babies will regain their birth weight in the first 2 weeks. Okay. If they're not getting enough, if mom's still worried, if they're not getting enough, we would count diapers and we would have decreased output if they're not getting enough. And then we would tell mom to increase the number of feedings, be sure they're taking in extra fluids, and that should help a lot. Okay, if a breastfeeding mother is complaining that her breasts are leaking milk, what would you do? For an effective intervention, you would use absorbent pads in her bra. Number 3. Okay. Colostrum. That clear yellowish fluid, we call it liquid gold. Moms can start seeing colostrum in the second trimester. They'll start leaking colostrum. And after birth, right after birth, this is the main source of nutrition for baby. And again, we call it liquid gold. It's very concentrated, very rich in immunoglobulins. It has actually less fat, but high protein levels. And that helps bind the bilirubin so that it can get conjugated and be gone. It also creates that laxative action, so meconium goes through baby faster, and we know that really helps get rid of excess conjugated bilirubin. Okay, so mature milk. So after that, after the first, on a term baby, after the colostrum, we have mature milk. So the first milk that comes out in the beginning part of the feeding is going to be the fore milk, okay? It's bluish, almost kind of clear in color. It looks a lot like skim milk. And then if you get through that 20 minutes after the initial letdown, you have the hind milk, and it's very, very rich, and it helps with the fat content. And so you want to get to empty both breasts. So this is also why we say don't start pumping until after the first 2 weeks when you have that mature milk source. And when you start pumping, you want to try to get that baby to suckle longer than 10 minutes so that the baby can get, the foremilk and the hind milk. And 10 to 20 minutes on both breasts, on each breast, means that they are getting all of that from both breasts. Okay, so these are the things that we look for. Having that everted nipple so the baby can feel the nipple. It's easy for the baby to pull in, and feeling that the tip of the nipple on the roof of their mouth to stimulate the suck reflexes. You have to be able to have that milk ejection reflex for sure. So that means adequate levels of oxytocin. You have to have an adequate milk supply, and I've known lactation consultants who just did not make enough milk for whatever reason. Mom has to be very motivated, and then it's critical that mom knows when to know that, or when to be able to see when the baby is ready to feed. Because if you wait till the baby's crying, it's not going to work, right? So what are some of these? You definitely need to know these feeding cues. Now, one of the best times to actually put the baby to the breast is when they're still asleep, but they're in their REM sleep. And you know if they're in their REM sleep by the fact that they have, you can see their eyeballs moving behind their eyelids. Putting the baby skin to skin at that point is good. Crying is a late sign, so you need to remember that. Crying is not the time. You got to get the baby calmed down before you can put them on the breast. So we don't have strict schedules of feedings anymore. We used to, but mom and babies should establish their own routines. And within usually that first 2 weeks, they kind of get the rhythm going. The duration, we want those feedings to last at least 20 minutes so the baby can get at that hind milk. That's important. You guys know about positioning. And then again, indicators of effective breastfeeding. You can get a nice review there. Nipple confusion is something that we look at. And again, we don't want to put nipples from a bottle. If we're breastfeeding, we don't want nipples from a bottle or a pacifier in the mouth for at least the first 2 weeks until breastfeeding gets really well established. And that's because it's so much easier to get the milk from a bottle. Babies eat a lot faster, and once they know that, they may get lazy and not want to work very hard. So if a baby isn't sucking, better to actually express the milk using a pump or hand expression and putting it into a cup or a syringe and just dripping it into the baby's mouth. So, and then pacifiers after that are good. They help prevent SIDS, and they strengthen baby suck reflex. So that's really good too. So here's the difference. We have the football hold. A is our football hold. B is the cross cradle. Baby's lying across mom's body. Mom's arm is in front. Cradle is C, and D is side lying. And And sideline is great, especially if mom's just had a C-section. We see that more often. Also, if mom is lying down in bed relaxing, babies can do sideline too. It can be easy once you get the hang of it, I think. The latch score, you guys need to know what latch means. Latch means, you know the point system. There's a care plan on 612 that talks about latching. Remember, L is the latch, A is audible swallowing, T is type of nipple, everted is best, it means it sticks out, C is comfort, and H is hold. There's 10 points max. If you have 2 scores in a row that are less than 7, you absolutely have to have an intervention there. Okay? Some things that we see often, again, you do not want to supplement at all. You want to try to exclusively breastfeed. If you start supplementing, your babies aren't going to be sucking as much, so the supply will go down. And again, you can pump and bottle feed, but it's harder to maintain a milk supply when you do that. And then pacifiers. Those nipples and pacifiers shouldn't be used within that first 2 weeks to a month. First few days, we do see sleepy babies. For a fussy baby, you want to calm them first. Slow weight gain, you need to really assess what's going on there. If they've had breast surgery, that can mean that they won't make enough milk, or you may have a blockage and they can't breastfeed. They might not be feeding often enough. They may be stressed or fatigued or not drinking enough water. So we would really look to mom to try to increase the feeding frequency. Okay, and then you guys can, if you want more info on this, look on pages 614 to 617. And jaundice, usually there's no intervention except breastfeed more frequently to get that fluid in to help flush out the conjugated bilirubin. Preterm infants, a lot of times, we don't feed those babies because we worry about their bowels having enough blood supply or mature enough to handle it. Interestingly enough, when a preterm baby is born, mom's breast milk is the perfect, it's made up totally differently than for breast milk for term infants. So the mom's body makes the exact right breast milk for whatever gestational age the baby is born at. Normally, if they're very preterm, they don't have that suck-swallow reflex, so mom will pump, usually at least every 2 hours, and then we will use that breast milk in the feeding tube. And we're oftentimes freezing that breast milk for a long period of time until baby can start using it, till we start feeding the babies. But oftentimes it's a long time. Expressing breast milk, every single mother needs to go home knowing how to, oops, I forgot something. And you can see this mom is nursing twins. Definitely can happen, takes a lot of coordination, and again, a lot of support. Okay, every mom needs to go home knowing how to express breast milk with a hand. Okay, hand expression. This is especially important when mom has some engorgement. You want that more gentle squeeze and expression because it will stimulate the nipples less. And what you're trying to do is just get enough breast milk out so that the nipple is soft enough for the baby to grasp onto. You can see this on top is hand expressing milk into a spoon for whatever reason to spoon feed baby if baby isn't latching at that time. And you think about when hand expression, you're just squeezing the breast, trying to express milk. but actually you grasp the breast, you push the breast back towards the body, and then you squeeze to get the milk out. So there are hand pumps, lots of different kinds of pumps, electric pumps. Most insurance companies will pay for a pump for mom. Teaching box, page 618, tells you all about storing breast milk. Let's see. Never use a microwave to heat or thaw. You want to thaw in warm water, warm tap water, and thaw slowly. And be very careful how much you heat. And milk banking is a thing now. Basically, moms will share their extra breast milk. It goes into a bank. It's usually, if it's reputable, it's pasteurized. This is donor milk for preterm infants or when mother's milk is not available. It's actually dispensed by prescription, and there are more than 16 milk banks in the United States. There are also milk sharing communities on the internet, and this is not pasteurized. There's no guarantees that mom is disease free. So they do carry those off-label sites, carry an FDA warning because it can expose the infant to disease and bacteria and maybe chemical contaminants. So you got to get that milk from a reputable breast milk bank. And here's mom pumping in front of her computer at the office. Yay. But with pumps, dual pumps, you can just get both breasts emptied at work. And you know at Sanford that we nurses who have had babies from all over the hospital come, and we usually can give them a room to do their pumping in. So the next two slides you can definitely read about. There's nothing in particular that you need to memorize on that. Know the variables that affect. Basically information moms before they have the baby can take classes, and afterwards too. Prenatal visits, they get information. Absolutely, the supportive family, friends, and the community are huge because it's all about commitment and client attitudes. You gotta wanna. That's my thing. You have to want to breastfeed because it's not something you can go into half-heartedly. It's just you're not going to be able to hang in for the long haul. Hospital practices, we now have baby-friendly hospitals, which is kind of a name for hospitals that encourage breastfeeding only. All right. And again, initiation of breastfeeding within the first hour of delivery, is really critical for success. Very important. Okay, breastfeeding mother, care of the mom needs rest, her nutrition. She needs 500 more calories a day. Even if mom is eating those calories, she tends to lose her baby weight faster, like 2 to 4 pounds a month. She needs to rest as much as possible because her body uses a lot of calories and energy making that breast milk. So we don't want to use soap on our nipples, well-fitting bra, contraception. We wouldn't give the mom any pills with estrogen. It decreases the milk supply. We really like to do non-hormonal contraception. After 6 weeks postpartum, you can do progestin only. So you can be on the pill and nurse. Breastfeeding during pregnancy, you have to really, it's possible for sure. You have to increase nutrition. A lot of times if mom gets pregnant um, while she's nursing, the milk may taste different and the baby may self-wean, but moms will definitely can tandem nurse. So if mom has a toddler she's nursing and an infant, she would nurse the infant first and then nurse the toddler. Let's see, but it can happen. Breastfeeding after breast surgery, it just depends on if they were able to spare the ducts, or if they interrupt too many ducts, then it won't work. Usually, if a mom is obese, there is a delayed onset of lactogenesis and decreased milk production. So in obese moms, we tend to see a shorter duration of breastfeeding. Let's see. Any medication, alcohol, smoking can decrease the amount of breast milk. Also, everything crosses into the breast milk. Even with that said, there are very few contraindications to breastfeeding, but any of these you're going to have a difficulty maintaining supply. We have no evidence, no FDA approval, no quality control with herbal preparations. So we would say no, don't do it to moms who want to take them. When providing anticipatory guidance to a pregnant woman asking about breastfeeding after delivery, the nurse would tell her the newborn must rest for 12 hours. The newborn could breastfeed right away. The newborn needs formula first. The newborn will receive water before going to breast. Obviously, 2 is the right answer. We used to give the baby sterile water before we fed them. For sure formula, but usually before breastfeeding. And that was supposedly to actually check that suck-swallow reflex so that they did not aspirate if they choked. So some of the things that we see, flat or inverted nipples, we can use different things to evert the nipples. The shields, the little suction cuppy thingies. Long-acting meds would be something you want to stay away from, and watching babies for reaction is important, and the doctor can guide them on that. Breast engorgement, you guys know about breast engorgement. I'm definitely not going to go into that. Breast shells are great for the nipple soreness and cracked nipples. Also, rubbing breast milk on those sore nipples is good. Using Lansino. You want to tell moms that they don't have to wipe the Lansino off their nipples, but some babies don't like the taste and won't latch. Plugged milk ducts are a problem. If you have plugged milk duct, there may be usually on the side, there's a tenderness or a lump or both. And mom needs to, you just would warm that up and gently massage the chest wall to try to get the plugged milk ducts unplugged and the milk to flow again. Now, between that and mastitis, what's the difference between a plugged milk duct and mastitis? Mastitis is an actual infection. Mom isn't going to feel well. It won't get better with just massage and heat. You have to get antibiotics. And mom will feel crappy, malaise, low-grade fever, that kind of stuff. Formula feeding. We have good formula preparations. It is possible to be allergic to it. Some formulas are not necessarily milk-based. We do give iron fortification since baby's not getting, let's see, it's easier to use, less time, and their mom's decision. We just really, really need to support her decisions while giving her um, all the information she needs to make an informed decision. Now, very important, if parents are formula feeding, that they reconstitute the powdered formula correctly. They shouldn't water it down to try to make it stretch longer, okay? Because babies cannot, don't concentrate their urine, and so they can have water toxicity or too much of a sodium load if it's too strong. So very, very important. Let's see. When you have iron fortified formulas, you may see more constipation also. So parents need to be aware of that. Not to make them feel guilty for their decision, but to give them the information they need to have. So, readiness for feeding is just like breastfeeding. Usually it's during the first period of reactivity. Formula is heavier. There's more volume to it. So babies can go 3 to 4 hours instead of 2 to 3 hours between feedings. It takes longer to digest, so it holds them off longer. We would always want to encourage parents to use bottle feeding as bonding time. Be sure babies can feel the parent's touch. Be sure that there's still that good eye contact. And as far as types of formulas, there's all different kinds. There's soy and lactose-free and just tons of different formulas. If it is, there's ready to feed formula, or you might have to reconstitute the formula, you need to know what kind of water that you have. If it's pump water, you may need to use like distilled or purified water for that if you have well water. Okay, and always follow the rules. You can make baby very sick if the rules aren't followed. So dads can do burping no matter if a baby is breastfed or bottle fed. Usually breastfed babies do not need to be burped as often because they don't swallow air like bottle babies do. So dads can be taught how to do that burping, and they get very proficient at it. Okay. A new mom wants to breastfeed and bottle feed her infant. What is the best information the nurse could give this mother? 1, she should choose one method. 2, she should pump and bottle feed the baby breast milk. 3, she should not introduce a bottle for 3 to 4 weeks until the milk is established. 4, she would be better off just breastfeeding. And the answer is 2. She should pump. We want the baby to get breast milk in whatever way we can get it to the baby. 3, we want to wait until, not be introducing a bottle. But this mom, and you have to assess where she's at with this. Now, culturally, Hispanic women, Mexican women tend to be uncomfortable with the fact that they're not making as much milk, so they usually want to bottle feed and then start breastfeeding. It's just something that they do, and yeah, you can still pick up and breastfeed after that, but it's a little more difficult for sure. Anyway, that's infant nutrition. I probably took longer than an hour. Sorry, guys. I'm not really sure. So, yeah, have a good evening. Talk to you later.